Renee, and to all of the Empowerment Faith Christian Church. Thank you so much for having me this morning. Anytime that I can come out and minister and give my testimony about breast cancer awareness and breast health, it is so gratifying for me, with me being a breast cancer survivor, and my grandmother on my father's side, she passed from cancer, so it runs all through my family. So thank you again for having me. Thank you so much. My pen is beautiful. And throughout the whole month of October, with it being breast cancer awareness, I get so many pens, but nothing as blinged out as this. Thank you so much. I do appreciate it. I'm going to jump right into it. Before I give my testimony, I like to go into a little bit of stats and a little bit of education, because my testimony gets real personal. So pull out your tissues. As you saw when you came in, when you entered the church, you saw I put up a breast cancer or a cancer awareness literature table. It is so important that you educate yourself on cancer, period. It will save your life. It will save your life. Please, readers are leaders. Readers, they save themselves. I'm just going to go over a few things that I have on the table out there. The first thing I want to talk about is the breast cancer self-examination card. Men and women should be doing monthly breast self-examinations. And yes, I did say men. One of the most popular male breast cancer survivor is Richard Roundtree. Do you guys know who Richard Roundtree is? Shaft. Yes. He is. He is a breast cancer survivor. So men, they are diagnosed with breast cancer. Men, this year alone, we will have 2,350 new cases of male breast cancer and 440 deaths this year alone. So men, please educate yourselves. Please take one of the breast cancer shower cards. This is a shower card. It won't get messed up in the water, because when you do your monthly breast self-examinations, it's best to do them on wet, soapy skin, because your fingers, you're going to use your fingers, they glide over soapy skin easily, and it's best to detect those lumps you might find, okay? So make sure you take one of these home with you. Also, I have literature about men. It says it can happen to men too. Men, please take that with you. And also the women. We have, I will say men and women, the ABCs of breast cancer early detection. That's what's going to save your life, detecting breast cancer early. And there's some things that you must be doing for your own health. Particularly 3 things. This is the ABCs of breast cancer early detection. Please, everyone, take this with you. This is your action plan to good breast health. The number one thing you should be doing is getting a mammogram. If you're 40 years or older, get you a mammogram every year. Now, if you're younger than 40 years, talk with your physician, because if you have a history of breast cancer in your family, if you're younger than 40, you probably should be going to get one yearly as well, okay? Also, you should be, we just talked about that, your monthly breast self-exams, okay? And that's every month. Every month. Do not miss a month. The reason why you do this is because you're becoming familiar with your body, so that each month you'll be able to detect an abnormality. Okay? You know, if you're not doing it every month, you don't have anything to compare to. So make sure that you're doing your monthly breast self-exams. The third thing that they talk about, the American Cancer Society talks about in the ABCs of breast cancer early detection, it's your clinical breast exams that everyone, men and women, should be doing every time they go get their yearly physical. You should be asking your doctor to perform a breast exam on you, because some of them won't automatically do it. Just ask them, doctor, can you please, examine my breast? And it's simply you lying on the table, lying on it, face up, and the doctor is going to perform what you're doing every month. The monthly breast self-exams, the doctor is doing that. And the doctor is doing it with a different set of eyes, with a medical set of eyes. So if they're doing that yearly, that's so powerful. So men and women, make sure you're asking your doctor each year when you go for your yearly physical to perform a breast exam. So make sure you go outside after service and pick up whatever you like. Oh, and there's one more other thing. I have this questions to ask your doctor when you're going for your mammograms, ladies. Because there's some questions you should be asking. Okay? And you might not know what to ask. This is really good as well. Then also I have some pens. One is the lavender pen. The lavender represents all cancers, your support for all cancer awareness. And then the pink ribbon represents breast cancer awareness, which, we just came out of Breast Cancer Awareness Month. Now, I gave you all of those stats, and, I talked about all of the literature, all of the physical things that your body might be going through and that you need to be doing. But breast cancer is more than physical. It's emotional, psychological, and mental as well. A lot of people don't talk about that. They don't. Now, for me, my doctors, my nurses, they prepared me for the chemo, the surgery, the radiation. I was so prepared. I was ready. I was geared up. But no one prepared me for the psychological roller coaster, the mental roller coaster, the emotional roller coaster. And that's what almost killed me. I became so depressed. I became suicidal. So that's what I'm really going to talk about this morning. Because, the physical, and, you probably heard, about the chemotherapy, how it wreaks havoc over your body. I lost all of my hair. 6 of my nails turned black and fell off. 3 of my toenails turned black and fell off. That chemotherapy wreaks havoc on your body. But that wasn't what got me. As I said, the emotional, mental, and psychological part prepared me. Now, a breast cancer diagnosis, it infiltrates a person's social and emotional spirit that, you can't even fathom. Only somebody that's gone through it knows what I'm talking about, okay? This morning, I want to take you on a series of journeys. Right now, I want everyone to close their eyes. Close your eyes. Just humor me and close your eyes, okay? Just imagine that you've just completed your yearly mammogram. Your doctor calls you to say, I see some changes in your current mammogram from your last year's mammogram. I'd like you to come in for further testing. After completing more testing, your doctor calls you in to her office. She takes your hand, she looks you in the eyes, and she says, it is cancer. The emotional and psychological trauma sets in immediately. Your heart stops. Tears start flowing uncontrollably. You no longer hear her, even though she's talking, but you don't hear anything she's saying. You feel like the rug has been pulled out from under you. You've been blindsided. You're thinking to yourself, how can this be? I've always been so healthy. My yearly physicals have been perfect blood pressure, perfect cholesterol. Questions start rushing through your mind. Am I going to die? Will I lose my breast? Will I have to go through chemotherapy? Will I lose my hair? Who's going to raise my child? Am I going to die? Open your eyes. You've just experienced my first day living with cancer. It was devastating. As I said, I was completely healthy. Even though my grandmother died from cancer, it skipped a generation and it got me. It was so emotional, I can't even tell you how I felt. Now, I want to take you on another journey, my treatment journey. I was diagnosed with a rare form of cancer, HER2, HER2. I went through surgery, a lumpectomy, October the 5th, 2012. 2 months of chemotherapy, which I completed December the 29th, 2012. 6 weeks of radiation therapy, which I completed March 20th, 2013. 9 months of antibody treatment therapy. That's when you go back to the chemo clinic. Once every 3 weeks, you sit there and you let them run a strong antibiotic through your system to eradicate the rare form. So needless to say, I had a lot of medicine in my system. I had gone through a whole lot. Again, it was devastating. Now I want to take you on one more journey. It was my hospital journey. Thanksgiving 2012, I ended up in the hospital because my portocatheter, do you guys know what a portocatheter is? Okay, a portocatheter is something that is inserted to your chest wall on the upper right side. Because when they administer chemotherapy to you, the doctors don't like to go through your veins because chemotherapy will burn your veins, destroy them. So they insert a portocatheter. And you have a large vein that goes from your aorta vein, and they put it here. Mine's got infected because one of the nurses did not clean it properly. That area, before they start administering the chemotherapy, they have to scrub that area because it's bacteria on your skin. And if they insert the pin in, they will be pushing the bacteria into your system, and then you'll get an infection. So that's what the nurse did. She didn't. She didn't clean that area properly. So I ended up with a staph infection that got into my bloodstream. I mean, my mother and my sister, they took me to the hospital. I couldn't even walk. They had to bring a wheelchair to push me into the hospital. And my mother and my sister, oh my God, my family was there. And I affectionately refer to my family as Team Turner because it really took a team to get me back to where I am. It really did. My mother, my father, they were at every chemo appointment with me. It was just, when I say that I was blessed beyond measure, if God chooses not to give me another blessing, I'm good. I'm good because, God showed up for me like no other during that time. Now, it's my hospital journey. I was there for 8 days over Thanksgiving. They had to remove the portocatheter. I had to go through surgery. During that time, I had lost all of my hair. I was so tired. The dark circles under my eyes. I had ballooned to well over 200 pounds because they were pumping strong antibiotics into my system. Now, the second day I was there, I got up, I went to the bathroom. I turned on the light. I looked in the mirror. I didn't know who that person was staring back at me. I was so depressed. Again, like I said earlier, I was suicidal. So, it wasn't the chemo. It wasn't the surgery that was taking me out. It was the emotional and psychological trauma. I was so depressed. Oh, my God. The next day, I was lying in the bed, and my dad and my cousin and my son, all of them were in my hospital room. They didn't know I was listening to them. So let me just stop right there. Whenever, or if you ever become a caretaker of a cancer patient or anyone that's sick, it's important that you speak words of encouragement around them. You have to speak life back into that person because this is what happened to me. My family, Team Turner, they spoke life back into me. As I was lying in that hospital bed, depressed, suicidal, my cousin, who was talking to my dad, they didn't know I was listening. Somebody must have asked him about me. But I heard my cousin say, I'm not worried about my cousin. She's the strongest woman I know. She's gone through so much. She's done this, she's done that. And he started saying all of these things about me, these wonderful things about me. And I heard him. I said to myself, you know what? He's right. And I remembered my favorite verse, Philippians 4:13. I can do all things through Christ that strengthens me. It was uphill ever since. Team Turner spoke life back into me that day. It is so critical, I cannot tell you, for you to find it in your will when you're dealing with someone that's sick, when you go to the hospital. I mean, they could be on their deathbed, but it could be you that God is sending to help speak life back into them. So find it, find the strength to put on a brave face. Go in, speak to them, pray with them. You know, remind them of all the powerful things that they've done. Remind them of their younger years, because I don't know where I would be if my cousin, Team Turner, if they had not spoke life back into me. When you're going through cancer or any other life-threatening disease, you have to activate your faith. You have to activate your faith. Because if you don't, the enemy will get all in your head, will get in your head. You will go to a dark place that you won't be able to come back from. So again, you have to activate your faith. You have to strengthen your relationship with God, because he is the only one that can help you come back from that dark place. As I close this morning, I want to close with a quote from one of my favorite women, second only to my mother, Michelle Obama, our First Lady. She says, "You never know how strong a woman is." Or, a woman is like a tea bag. Yes, a woman is like a tea bag. You never know how strong she is until you put her in hot water. Wow, I love that. I love that, because breast cancer was the hot water for me. But with God's help, me activating my faith, and with my family, Team Turner, speaking life back into me, I'm here with you guys today. I'm here with you today. So after service today, make sure I'm going to be out there back by the table. If you have any questions for me, for any woman that might be, I don't know, you might be going through what I've went through. I want you to ask me about the different support groups that we have in Memphis, Tennessee. We have so many breast cancer support groups that can help you, if you need a team that's going to help you get back to where you were. So again, I'm going to be back there at the table. We have pens out there, the lavender pens. I have the shower cards. I have the pink ribbons. Ask me anything you want. It doesn't matter. I tell people, because when I talk to people, they say, "Oh, should I ask you that?" It was one woman asked me, "How did you feel when you lost your hair?" Because she was getting ready to go through chemo, and we stood there, and I must have talked to that woman for about an hour. But again, I thought about Team Turner speaking life back into me, so I might have been speaking life back into her. That's part of ministry. So again, thank you so much for having me this morning. I appreciate your attention. And after service, I will be back by the table speaking to you about all of the literature that I have. God bless everyone. Thank you, Pastor Larry and Renee Smith, for having me. And God bless.